Now we've talked about Clubfoot. Okay, I'll come back to it, but I want to also digress. Like I said, every time I have people like you, I like to talk about so many different things.
Yeah.
See, in healthcare in Africa, we have many challenges. You have mentioned some of them, okay? But tell us, what challenges do you think are the biggest affecting healthcare sector in Africa?
The biggest, I will not mince words, and I say this with every sense of humility and responsibility. Our biggest problem is corruption. In Africa, in Nigeria. I'm not going to go too deep into it. I'm not a political science expert, but even as a baby, even a layman can see that sometimes, I just keep using COVID as an example. Even when some people donated money and bought some things to relieve people of the stress of COVID, it was hoarded until I think some of them started expiring and stuff. Do you know some of our vaccines, some of the vaccines that we get from overseas, even those that are supposed to maintain a cold chain? You know what cold chain is? You must, from the manufacturer, it must be in a fridge. It must be cool as is coming in. Whether it's DHL that is bringing it, is in a fridge. You know, even some vaccines that are, even some drugs, you know, this immunization we give our children. Some very sensitive medications, do you know, they hoard it and it expires and then they discard it. So corruption is at the center of what we're talking about. It's a big issue. I already spoke about political instability. An economy cannot progress if there's political instability. It's not just about foreigners from developed countries coming to establish. Even within us, see what is happening. So during cashless policy, during this, so many things, so many regional clashes. Sometimes there's a curfew. Sometimes they give 6 a.m. to 6 p.m. coffee. Sometimes out of fear. You know what of this sit at home that happens every Monday in the East? These are all sources of political. These are all examples of political instability that affect the economy, affect health, affects education, affects every single thing that we do. And then I want to reiterate poor infrastructure. These big things: corruption, political instability, and poor infrastructure. Because sometimes you even have exchange programs. When we're in medical school and even in residency training, you have exchange programs whereby some Nigerians go to China, some Nigerians go to the US, some US students come over. When they come over, they don't even have enough, even some doctors, they don't have enough equipment to work with, you know. The reason why it seems like Nigerian doctors do very well when they go abroad is that when they go abroad, they have all those tools, all those things they were seeing only in movies or in their textbooks. They have it to work with. It makes work easy and more efficient. You have an app for scheduling patients. You have an app for some you have some diagnostic tools to help you think about possible options and to rule out many things. So life is not like it's easy, but it's easier and approachable. Yes, it's easier and more efficient. If you're supposed to see 5 patients in a day, if you have everything that is working for you that has been said before, you may be able to see 10 or 15 patients in a day. So these are the issues that we are talking about.
See, for me, it's not only in the medical profession or sector. One thing I see, and I will say this, I've been talking about it: affirmative action, national, we call it a national character. It's a big deal. Okay, because what it has done for decades is it has promoted mediocrity. See, this is why we have so many mediocres in positions of authority.
Yeah.
And I don't know when we Africans, Nigerians will finally see that this has not worked. Everybody is suffering. In the medical profession, the people in power go out somewhere to the Western world to take their treatment, and they leave everybody else to suffer with the bad infrastructure, without the right medications, and it started from affirmative action.
Yeah.
Right now, absolutely. In secondary, I see the cutoff mark of students going to secondary school, government secondary schools or universities. The disparity.
Yeah.
Okay. The disparity between someone from east or west or north, and they're supposed to be in the same class, studying the same material. And we I mean, how does that work?
Yeah.
Anyway.
Yeah, I went to school for the gifted and talented. I went to Suleja Academy. That was my high school, and it was on scholarship.
Okay.
However, national scholarship. They got two persons from each state, and they put us together. However, when I was in SS3, when I was just about to enter SS3, so they introduced this quota system, whereby whether it was no more on merits, whether they get to the cutoff mark, any two persons will come from the state. Any two persons. So I got a roommate that couldn't say her name. This is my personal story. I had a roommate that couldn't say her name. So you had to teach her that what is your name? This is the response to it. So sometimes you now ask her, aren't you going to eat? She'll tell you her name. She'll think you're still asking her, what is your name?
Oh my God.
Will you like to join me to the dining? She would repeat her name. I don't want to call her name just for privacy. She repeats her name. So this happened right before us. Of course, when she got to JS3, she was frustrated out of the system. But these things happen. Quota system, we are so used to you give this person, you give this person, you give this person. Whether the other party is ready to take, like we see a lot of some appointments, I don't want to, I'll say this off record, but we'll see a lot of appointments that that this person is not the best.
Yeah, not qualified.
You understand?
Yeah.
Yes. All those ministerial appointments and stuff. That's fine.
But see, it's not only in Africa, okay? It also happens in, let's say, America. The same thing happens, and it's breaking down that society. Okay, the same thing.
Yeah.
Okay. See, these are things that if only we learn from the failures of the developed world. Okay, so that the things they fail at, we look at it, we study it,
and learn,
and make sure we don't implement those things in our country.
Yeah.
But unfortunately, nobody is interested in those things.
Yeah.
Anyway,